Good afternoon. I am presenting a paper on dry eye among healthcare workers wearing masks during COVID-19 pandemic. After COVID-19 was declared pandemic in March 2020, government health authorities made wearing of masks compulsory. There was increase in dryness among regular mask users, and previous studies have assessed the dry eye disease symptoms in mask wearers, but objective assessment of dry eye among healthcare workers has not been addressed. The mask use will continue for months or even years, and the prevalence of dry eye will increase in the coming years. The objective of my study was to estimate the proportion of dry eye among healthcare workers wearing masks and to find the association of dry eye symptoms, tear film breakup time, and Schirmer's test with socio-demographic factors, duration of mask wear, ill-fitting mask, and the type of mask. My study was a cross-sectional observational study conducted in Tertiary Care Hospital in Puducherry after approval from the Institutional Ethics Committee, and sample size was 384 participants. We collected details such as demographic details, symptoms of dry eye, type of mask worn, duration of wearing mask, awareness of upward airflow, and basic slit lamp examination was done, Schirmer's test, and tear film breakup time was done. And the analysis was simple descriptive analysis, and categorical data were represented in percentage and continuous data by mean plus or minus standard deviation. And any p-value of less than 0.05 was considered statistically significant. Abnormal T-butt was considered as dry eye, and awareness of upward airflow towards eye as an ill-fitting mask. So this is a graph showing distribution of participants according to age, and most of the participants, that is 78.9% of the participants, were between 21 to 30 years. And current study showed no significant difference in DEDs, T-butt or Schirmer's test with age, which is comparable to other studies. Most of the studies on dry eye showed significant dry eye in elderly population. This may be attributed to a smaller number of study participants above 40 years of age in this study. Male to female ratio was 1:2.15, and most of them were doctors, that is 40.9%, and T-butt was found to be reduced in 89 participants, and ST was abnormal in 12 participants. And 37.8% complained of burning sensation, 27% complained of dryness, 24% complained of irritation, and 11% complained of watering. And the graph showing type of mask use according to occupation. Most of the doctors were using N95 mask, and the staff nurses were using mostly surgical mask. So all DEDs had a significant association with T-butt, and dryness and burning sensations were significantly associated